going through a screening questionnaire for everybody coming in.
Yeah.
But if you have not traveled anywhere, you should still be staying indoors, especially if you're over 65. Yes.
So you're suggesting that if a person is over 65, yeah, you need to be cautious, not because you're 65, but everybody should be cautious.
Correct.
And the people that should be the most cautious is the people that are older, and if you've traveled, protect the rest of us.
You know, one thing that somebody asked me recently was, you know, can we play with our grandkids just because they're home? The answer is no. Do not pick up your grandchildren, because we have noticed in this COVID-19 that kids are actually not affected as much for reasons, again, that are not entirely.
We're doing the best we can. Exactly. One good news is 3M and Honeywell are starting to mass produce N95 masks. So that should be good news for all of us. And of course, gowns were also disposable gowns were in shortage, and I believe that there's a urgent supply of that coming in. So when you go to examine that patient in the ICU, what kind of protections are you taking? Are you wearing goggles? What are you doing?
Right. So there's usually the N95 mask. There's a face shield. There's a cap that you wear over your hair. You want to wear your gowns. There's also gloves that you wear, and technically booties that you put on your shoe covers that you put on your feet as well. You could do all that. Now, it's just tricky, because if you go in multiple times, every time you come out, it needs to be disposed of, and you're doing intermittent hand washing, hand sanitizer, etc. And just to take off one article, and then you sanitize. So that's where the problem's occurring, is that you're going in, coming out, you may have to go in again, you may have to come out. Yeah. And the other issue, of course, is when we're intubating patients. I mean, when you have someone that you have to put on life support, your face is about this close to them. So there is no 6 feet. You can't do it that way. And then the droplets, of course, are going to be very close to you and could get into your eyes, etc. So that's why the N95 masks are so important. There has been shortages as well, where people have been taking things from hospitals, and we understand the panic, we understand why you're doing that, but at the same time, if we're not around to protect you, there's going to be a downfall, and it'll affect you at the end. So that's why it's really important to protect your healthcare workers, regardless of doctor, respiratory therapist, nurse.
Face masks, we have N95 respirators as well, but I agree with Dr. Patel that there is limitation in the hospital too, and it's just not Greenville, it's across America. Yeah. So be careful and try not to steal stuff from the hospitals.
So we're looking at some more questions, and
I mean, we can help you with that.
Yeah.
All right. So one of the common questions we are getting is about the, as you know, we are heading into the spring with the pollen season coming in.
Yes.
So how do we know that, how do you differentiate, like when somebody is allergic to pollen and having a cough and running nose and all, whether it's allergic or whether it's with the COVID-19, how to differentiate that?
So that would be a field that I would probably come across more, because these are patients that are traditionally patients of a primary care, and this is your season to get allergies, you're allergic to the pollen out there, and all of a sudden now when you get those pollen symptoms, the achiness that comes along with it, the stuffiness that comes along with it, and little dry cough that comes along with it scares you. I understand that. So when that happens, think over. Do you have exposure? Have you traveled recently? Have you been on a cruise recently? I mean, those are issues that I would be concerned by. But if you haven't traveled, if you do not have a fever, if you are not feeling terribly bad, chances are it's probably not COVID-19. My suggestion though, still, till we know better, put a mask on. Why? Because if in case you have it, I don't want you to give it to the rest of the family members. Stay home, which means the most people you will infect in a worst case scenario is the 4 other members in your family. Otherwise, you will, if you're out in the crowd, you're infecting far more. So stay home, put a mask on, take your allergy medications, call your doctor, talk to them over the phone, do your televisit with your doctor, and then get their instructions. If they treat you for allergies and you're getting all better, chances are we're okay. But if you start developing a fever, or if you start developing a shortness of breath or something disproportionate, then of course call the doctor back, because chances are now you will be in line for a COVID-19 testing. And obviously if it gets so bad that you need to head to the emergency room, Dr. Ravi will be ready for you, for people like you. But just remember, when you come there to the emergency room, call in ahead. So we want Dr. Ravi and his team to be mentally prepared to gown up, to dress up, so that they're not walking into a trap. Because we need our healthcare workers. And if this goes on for as long as we think it might, we're going to need them to be in good health. Yeah? Any other questions that you have got?
There have been a lot of questions around the chloroquine. Like a lot of people are asking,
Right.
Should, as a precaution, should they go ahead and try to take those things?
Is chloroquine a precautionary measure? Like for malaria, you're taking it
No.
once a week? No. No. Answer
Not
is
this
no.
time.
Yeah.
Right.
The answer from the panel is no.
And on the same thing for the immunity, people are asking, are there any vitamin supplements like vitamin C, D, or anything could be taken up? I mean, just to make themselves immune.
Well, they can take anything to boost the immunity, but these are all anecdotal. There's nothing, no science behind it. But there's nothing against not taking them. They can take them, but that does not mean that they will be protected.
So the Indian population that obviously we are part of have a lot of B12 deficiency and a vitamin D deficiency. Those do have impacts. So obviously our thought process hopefully is take it. It doesn't hurt.
Exactly.
I mean, we're not going to say don't take it. Take it. Sleep well. Eat well. Drink and hydrate. Yeah.
Use just general precautions that have been
Yeah.
explained several times. Hand washing, social distancing. These are the things that actually will prevent spread and prevent you from getting the infection.
Yeah.
Rather than just the vitamins, which you can take for other reasons that you've been taking before.
Yeah. Let me pose this question to Dr. Oza. Do you think one can have COVID-19 with no fever?
Yes,
Yeah.
absolutely.
Yeah.
You can have asymptomatic COVID-19. In fact, that's what we're seeing for like the first 3-4 days. You may not even have a fever, yet you still have the infection. So you can still be shedding the virus, what Dr. Patel was saying earlier.
Yes.
But yes, you can absolutely have COVID-19 with no fever, no symptoms.
And if you're very immunocompromised, you may not mount a fever.
Not a fever, and the response when you do get it might be at a lot later stage, a lot worse stage.
Yeah.
But you might need the ventilator, you might need other things.
So yes, you can still have COVID-19 without the fever. Somebody's asking the question, how can I prevent COVID-19? I think once again, let's all reiterate one item so start with you.
Hand washing 20 seconds.
Hand washing 20
every
seconds.
time you touch a surface.
What would you suggest?
Self-quarantine, don't go out unless you absolutely have to.
Yes, social distancing.
Social distancing being your big one, yes, yes.
Social distancing.
And coughing into your sleeve.
Yeah.
So if you're sneezing, coughing,
Yeah.
you should protect yourself if you don't have a mask.
And then of course, in my case, I would say all of this plus if you think you have COVID-19, put the mask on, call your doctor. That would be the next step.
Correct.
Now the other question that I got was, is there a quick contact number for Greenville citizens to call for any questions or concerns or testing needs? Yes, like I said, there is those 4 teleconferencing sites. Richland Memorial has one, McLeod Regional has one, but the 2 big ones for us are going to be obviously Roper St. Francis virtual office and Prisma and their virtual office. And I've been told that if you use the code COVID-19, that is no charge. So it's not like they're going to charge you. You can always call. Now don't forget, IAG itself has a website, and it has put down a number that you can call for questions. Now if they're health related questions, give those questions to them. They will forward us those questions to the team. And the number, I believe, is 864-513-1561. Once again, the number is 864-513-1561. Any questions that are asked of that site will be forwarded to one of us, and we will reach out to you and reassure you. I'm sure there's more providers in the community, in our networks, who are willing to take on questions. We're here for you, Greenville. We're here for you, upstate. Whether you happen to be Indian or whether you happen to be somebody else who's not Indian, and you just want to talk to us, you want to do a teleconference with us, we will reach out to you. We will help you out. These times are tough. These are unusual times. Each one of us went into medicine not for any other reason but to be there for you guys at a situation like that. Am I not wrong?
Absolutely.
So, absolutely. So, everyone will be ready. And once again, we have one more question, I suspect, so we can ask the question. Can you ask the question, Sanjay?
Yeah, I mean, there were a couple of questions came in about, visit to the grocery stores and all. So what people are asking is like what hygiene measures they can take, and they have to wear the gloves and mask when they go to the grocery stores, and as well as, what hygiene precautions they need to take when they pick up this stuff
Yeah.
and use it at home.
So we've probably gone over this over again, but I think, once again, Ravi, if you don't want to mind repeating what we've discussed.
Sure, the basic principle would be, washing your hands after you touch something, so
Yeah.
before and after. And I think if you do that every time, as far as going to the grocery store, if they don't have sanitizer, and if you don't have it,
Yeah.
then just assuming your hands are soiled and you come home and wash them,
Yeah.
and wash down everything you touched en route.
Right.
So,
And do talk about that, the box that comes from Amazon, or box that comes from Walmart.com.
so they're saying that, the virus can live on, cardboard, plastic, everything for about 3 days. So, don't expose everyone to that box. Basically, have one person handle it, and take out the contents, wash your hands in between each procedure.
Yeah.
And, before you grab it, after you grab it, after you take it out, throwing it away. That way, you're not exposing anyone else needlessly, and one person has chain of custody of it, basically.
Right. Dr. Nancy, the question also asked is, should we be going to the grocery stores with gloves on and a mask on?
I don't believe that's necessary. If you are away from people at 6 feet like you're supposed to, the only thing you may want to do is wipe down the cart, make sure that the cart is clean. But remember, this is droplet. Somebody really has to sneeze or cough on you for you to actually be able to get that close to someone. That's that protection.
Yeah.
And it's not the general public that needs to go out with masks, gloves, all that stuff, because you aren't really that close to people if you're doing proper social distancing.
So yes, that is the emphasis. The emphasis is you don't have to panic, be vigilant. You don't have to go to the grocery stores all covered up, but you just have to make sure what you're touching, and when you touch it, if it's something that you don't trust, wash your hands. And if you're sick, don't go grocery shopping. And if you are sick or you're
Because,
not sure,
you
wear a
know,
mask.
you
Definitely wear a mask.
aren't really that
And the
close
other
to
thing, too,
people
about grocery
if you're doing
shopping is
proper social
try to limit
distancing.
your trips.
So yes,
Say,
that
go
is
back to
the
everything
emphasis.
you
The
need.
emphasis. You don't have to panic. Be vigilant. Covered up, but you just have to make sure what.
Try to make it where you don't have to go for another week or two.
Yeah.
Don't hoard, don't
Yeah.
just buy everything off the shelves.
Right.
But have enough for you and your family to maybe last you 2 weeks, so that you don't have to make that trip all over again, because, you ran out of tomatoes, or, you gotta find
Yeah,
something
it's supposed to be
that
six,
you're-
or probably maybe two.
You're always doing it.
Right.
Buy canned tomatoes instead
Yes.
of always going for fresh. Is to try to limit the amount of times you go out, because you are exposing yourself when you are doing that. So just to minimize exposure for yourself, it's good measure to do that.
Do we have any other questions, Sanjay? Otherwise, yes.
Yeah. Are person with a good immune system, vitamin D, less likely to get impacted by the COVID-19 virus than the ones that have the bad immune system?
So you mean to say, let's say if somebody is known to suffer with a poor immune system, will vitamin D boost them up? The answer is, there is no proof on any of this with vitamin D. All we know is that vitamin D is a very critical element in the cells that partake in your immune responses. So there is no study that can tell us that if you take vitamin D on a regular basis, that your immune system will be better than other people's. All we can say is, from the theoretical studies, yes, it should technically help. I'm a big believer, if you have a problem with vitamin D, treat it. But can I confidently, even though I'm a believer, can I confidently say you should take vitamin D mega dosages at this point? I am not. I'm going to say, if you've always taken it and your level is good, continue to take it. If you've never taken it, you may want to test it before you take it, because you can get toxic on vitamin D. Yeah? Do you all agree with that? Yeah. Yes. If there's no other questions, I want us to for everybody to over again reiterate, why is this important? Why are we talking about this as a forum today? And why do we not talk about flu? Why?
Well,
Santosh, why?
so this is a new infection, a new disease that has inflicted on us. And now we have to see how we can prevent the spread of it, not just for ourselves, but our family and the world at large. So this infection is not known. There's not much information on it. It's evolving as we go along. So we have to take adequate precaution, and the best precautions we can take is wash our hands, social distancing, clean the surfaces, avoid traveling out and quarantine yourself at home if not necessary to go out or do anything that is absolutely necessary.
Dr. Oza, what is your thoughts? Why should somebody watching this stop and think today? Besides, of course, panic and fear, which we're all suffering with.
Well, more than anything, yes, it's the unknown, but I think also change in our lives, right? We are doing social distancing. When was the last time we did social distancing? Not in the last 37 years, which is when I was born. I can't remember this being done my entire lifetime. So I think this is really a once in a generation kind of thing that we are asking everybody to do. The CDC is asking everybody to do. But more than that is what she mentioned earlier. We don't have that many resources. You know, we don't stock up ventilators in the hospital. The government does not have a warehouse somewhere of 1 million ventilators. It doesn't exist. She could probably give the exact numbers of the ICU beds in all of America. Now, if only, like she mentioned, with 1% of 330 million people needed to be admitted.
So you're worried about that 1% of that 330 million.
And I think that's the overall concern is not the 80% that will get better. It's the fact that the 80% can actually spread that. And then the people who will get sick, those sick patients will end up in the hospital. They can also get all of us sick. So we need to have protection as well. So the resources is an issue. So we have limited resources, and I think that's the biggest concern.
So Santosh, you felt it's a novel virus. Human beings, we don't have immunity. We don't know how devastating this could be. You feel that the resources are so limited that, hey, if we don't acknowledge this and work with this, we're going to be in trouble. Nancy, why? Why should anybody listening out there stop being cynical and pay attention?
Well, in my profession and what I do, like I said before, I never want to have to choose one life over another. And so that is my biggest concern, is that will I have to choose your mom or your spouse? You know, who am I going to choose when it comes down to giving life support or those life-saving measures, etc. I don't want to have to make that decision. That's something that we normally, I never really ever have to do, because we are abundant here. And you know, we are abundant in this country. We have lots of resources. But in a crisis situation like this, it is imperative that everybody stay at home. If you want to I understand staying at home is not easy. You know, we have kids at home now that need to be homeschooled. It's definitely changing everything. But at the same time, you really need to do that in order to just save lives.
Ravi, anything you want to add to what we've discussed? Because Nancy has reiterated she doesn't want to be in that bad spot of making a choice because the resources are so severely limited.
Sure. I think my plea would be to the general public to basically, understand our capacity. And all we're asking is to, let's limit the spread, flatten the curve, so we can adapt and rise to the challenge. We need time. We need time to make more ventilators, more masks. We're smart ways. We're gonna get through it most likely, and we just need time to kind of give us time to react to it.
Right. So your suggestion is flatten that curve. If we do the social distancing, if we keep away from people and we don't let it spread, it will still persist in the community, but we will not have that acute peak.
Right.
We will just space it out over a period of time, which will give all of us chances to tackle it better. Now there's more questions, so let me ask one more question. Yes.
Yeah. So there are a couple of questions again came in regarding the testing. So one is, I'll just generalize these questions. So the person that is going to visit the testing center, how long the testing takes, and do they need to wait? I mean, the person and as well as whoever is accompanying, do they need to wait at the test center till they get the results? And what is the time period to get the results?
That's a very good question. So I have sent patients, and first of all, I have done some tests in our office, not office, but in the car. While the patient is parked, I'm dressed, I'm wearing the personal protective equipment. And I've done the test, it's gone to LabCorp, it will be 5 to 7 days before that result comes. So in my case, the wait time was not very long because I put everything else on the back burner. I walked to the patient, I did the test. But most of the people are going to be going to these big testing sites like the 701 Grove Road South Deck parking with your order. When you go there with the order, there's a team that's already masked and gloved, and they do a quick test. They get the stats from you. So it's not a long wait. It's very short. Correct me if I'm wrong. That's what my patient said. It was not a very long wait. The bigger deal was if they showed up without the order to do the test. That's when disaster happens. So, and it takes about 7 days, and the doctor does not get the report. The patient gets called. So just keep in mind, it takes about 7 to 10 days, and the patient gets called, and the doctor does get informed as a secondary. Any other experience on the testing in the hospitals and
No,
elsewhere?
it takes about 3 to 5 days, the real-time PCR testing. But
Yeah.
To add to that, don't just go to these testing centers because you're scared that you might get it. So you don't overwhelm them, because the more people that get tested, it may probably delay the results of the test, because then the CDC and the other organizations that are running these tests will get overwhelmed.
Yeah.
So that's just
Yeah.
one more.
A follow-up on that one, while they're waiting for the test results,
Yeah.
Do you all recommend them to be self-quarantined for that period?
Yes, yes.
So the question is, do we self-quarantine the patient while they're waiting on the test? Yeah. Yes, absolutely. Mask on, and use our, keep the other members in the car safe, keep the providers safe.
I think
Yeah.
even
When you go
say,
home.
even when you
Even
go
when you go
home,
home, yeah.
until you get the result, you
You will
quarantine
quarantine
yourself.
yourself.
Absolutely.
At least for 14 days.
Self-isolation,
Yes.
essentially.
And then if you don't have any symptoms by then you're okay. But if you, at least for 14 days, since you first thought that you probably had the symptoms, or you were in contact with somebody who had the symptoms, or you traveled to a high risk country. Or
At this point, the algorithm says that if your provider is ordering the test, they have a high suspicion
Right.
that you may have COVID-19. So self-quarantine should be started just based on that, whether the test
Absolutely.
is positive or negative. So,
And when
So-
you are quarantining at home, just to add to that, make sure it's one person that's in contact with that person if they need to be. We have a lot of elderly people who can't really do things for themselves, so it should be just one person in contact if needed to be involved in that care of that individual. It shouldn't be multiple people having to care for that individual.
Absolutely.
practice kind of social distancing at home also.
Yes.
Yeah. So the other question, we have a couple questions on, like, okay, so once a person
Yeah.
gets cured, I mean, so let's say like if somebody has
If a
a
person is
COVID-19
cured.
and he's cured, what are the chances that they are again going to get infected, or that's resurfacing?
That's a tough question. The question is about COVID-19 infection, active, treated, and then do we get,
So right now, there's no data, because this is an evolving thing. Likelihood is less, because now you develop immunity and antibodies, but again, there's no data on that to state whether you get reinfected or not.
there is some information out there. They're saying that there's just like the flu, where there's different strains.
Right.
I believe there's 2 strains to this so far that we know of, that one mutated. So even though you had one, you got over it, and, but there's a possibility you still get the other one. So, we don't know yet.
Right. So there is one other drug-related question. I mean, lyrium, mefloquine. So people are asking, like, do you have any suggestion for mefloquine?
any ideas on that, Dr. Nancy?
Once again, it's too early to tell. Anything that's investigational right now, you really just need to wait for further recommendations from the FDA, and a lot of it will be used in compassionate use in the sense of, a hospital setting or in an ICU setting where we're gonna try to save your life using these medications. We will give you everything, trust me, that we possibly can if you are that sick. We will try our best to do what we can to save your life. We just need time.
All these medications,
Yeah.
if you just take it, they all have side effects.
Right.
Right,
And a lot
and
of
then we will
medic-
see you after that.
And then they'll be seeing me after
Uh-huh.
that with a liver failure.
Nausea, vomiting.
Or
Yeah.
nausea, vomiting, or something along those lines, or
Vision.
kidney failure. So there's, all these drugs have side effects, so don't just take it
Yeah.
because
It's all
you read
about-
something.
Yeah, it's all about risk benefit. That's the way we all practice medicine, is if it benefits you and the risks are minimal, yes, you should take it. But if the risks are low and there's not enough evidence or data to suggest that this is going to help, you shouldn't just go take it.
Right.
So the most important thing we actually could have done the whole time, if we, instead of stressing out about whether chloroquine is available or mefloquine is available, not that I'm downplaying those questions, I think instead the takeaway should be, if we socially isolate, if we keep from the high-risk people, if we do the hand washing, if we stay home and stay put, I honestly think that will reap us much better rewards, because the number of patients will be less, the curve will flatten, we will still have those cases, we'll still have 80% of us get better without any trouble, we'll still have the 20%, but it will be 20% of 100,000, not 20% of a million. Big difference. So we can flatten that curve, and that's the point I want to make over and over again. Yeah?
Alright, so this is my question, I mean, it's not
Yes.
from this one. So we talked about all the concerns and all for the general public. So here, you as a physician, how you are all handling this stress and all those things? I'm guessing like there is a lot of stress on the, not only physicians, everybody who is working in the medicine field, right? So maybe can you shed some light, like how you're all coping up with that?
And let's all of us give us a sense of what we're feeling. Personally, myself, of course, there is a little bit of fear, and then sometimes there's bravado, and then sometimes there is like a surreal feeling like this can't be. I'm not existing in this time. This is not happening. So when I am scared, it is because when I hear about the cases in Italy, or I hear of the stats in Iran, and I realize, oh my gosh, if we were to follow that trajectory in this country, then I guess there would be a lot of sick ones. And if Governor Newsom of California is right, 25 million will be infected out of the 40 million, then that means every other person will be infected in California. If that is to be true, at those moments when I hear that, it scares me. Not for myself, because hopefully I'm in the lower risk category, but I worry about how it will impact all the people around me, the older friends of mine, patients of mine that have end-stage renal disease, that have COPD, congestive heart failure, patients with atrial fibrillation, or diabetics who are very poorly controlled. I'm not worried about my well-controlled diabetics, so let's not freak out diabetics. I mean, we're talking really badly controlled diabetics. So for those patients I worry about. I also worry about what it is doing to the economy, and by doing something to the economy, it probably is impacting my patients and my staff and the people I know who are hourly wages. If the government doesn't come through, then that is devastating. So I'm scared for that reason. At some points, like I said, I feel very...
Let us do our job. Like someone said, I stay at work so you can stay at home.
Yeah,
So
very
please
well
do that.
said. Yeah, yeah. Dr. Oza, what are you thinking?
Yeah, the same thing. I think for me personally, I always, I look at everybody I work with,
Yeah.
whether it's the cleaning staff, whether it's my techs or nurses, and I feel everywhere I look, whether it's like the food service workers, whether it's in this hotel right now, it's the hotel workers. Yeah, I feel a little stressed like going to work. I mean, you never know when you get infected, it's possible, but you just do the best you can and keep at it. But everybody else around me that I'm surrounded by has way more stresses than I do. So for me, it doesn't. I just look at other people. I'm like, well, I'm in a lot better place. So I just.
That is true. You're counting what you're grateful for, essentially. That's wonderful. Yeah. Dr. Nancy, what do you think? What are you feeling when this whole thing's unfolding?
So obviously, as a human,
Yeah.
you definitely have anxiety. You
Yeah.
definitely have fears.
Yeah.
And we are exposed to things like this. But I think, being part of a two-physician household,
Yeah.
being in the front line, both of us being in the front line, I think the biggest concern is what if either one of us gets sick or both of us get sick? And I think there's lots of situations like that with other healthcare providers, whether you're a nurse, respiratory therapist, like I said, that raises that concern of what if I become exposed and I get sick?
Yeah.
And I think as healthcare providers, we may be more susceptible in the front line, especially to getting sicker than the normal public technically would, because possibly we're being exposed to more of the virus. So the question I think that always weighs on my mind is what's going to happen to my kids and stuff like that. And hopefully, at the end of the day, I pray. I just kind of leave it up to God, and whatever happens will happen, because that's all you can really say to yourself. So I usually just look to my faith and try to find comfort there.
Yeah.
Because in times of crisis, I think it's important to pray,
Yes.
to pray for yourself, to pray for other family members, to pray for people that you don't even know, and
Right.
to pray for this country. We're going through a crisis. This hasn't happened for a very long time, so we really need to just focus on what we can do and try to control the fears by preparing and making sure that you're doing your part, like I said before.
Ravi, any thoughts on that?
Yeah, I think, you know, obviously in my field, being a ER doc, you know, the stress is the nature of my employment or my job, basically. So, you know, whether it's, you know, I may contract some sort of HIV, hepatitis from a needle stick, or, you know, if we have cures for it. I think the biggest anxiety with this is that, you know, it's a new virus and, you know, we don't know what we don't know, you know, so that's the anxiety of it. On a personal level, you know, I agree with my wife. I think that, you know, both of us having this such high exposure, you know, we worry about our family, obviously. So, you know, we try to do what we can to reduce our contact, you know, bringing things home or washing our hands, taking showers, stuff like that too. But, you know, at the end of the day, you know, you have your personal life and you have your professional life. So, and, you know, we gotta work out a balance with that.
So I think we're going to come to a conclusion on this one, but I would like to look out for the optimism in this. One, apparently with all these restrictions, the water in Venice is cleaner. We're listening to the birds more. We're staying home. We're spending time with our families. We're educating ourselves better. So there is some silver lining in all of this. We hopefully will be better prepared than ever before for another pandemic going forward in the future. Mankind will make sure we're prepared, right? So that those are the good things that came out of this. But remember, 80 out of 100, we will get the coronavirus. We will be devastated by the news. We will self-isolate, but we will get over it. The problem will be if we don't socially isolate ourselves and self-isolate, then we'll spread it to somebody that is at high risk. But the bottom line is 80% of us will be fine. And most of the young ones, as long as they do their precautions, we should be fine. So take hope in that. It is tough times, but it calls on us to reach down deep, for us as providers and physicians to do more than we've ever done. And for the rest of us as the audience to stay positive and do the right thing by other people's. Count your blessings. And at this point, I would like to thank IAG President Dr. Mr. Sanjay Tellur for organizing this. Very noble. He's channeling his positive energies with his team. And I know Shiva and Ram have been here, and they've been very valuable in transferring the questions and making sure this video feed gets to you guys. So I want to have Sanjay say a few words. Sanjay, please, would you like to conclude?
Yep. Okay.
That's okay.
I would just like to take a moment to express our sincere thanks to all of you. I mean, you know, and you don't know how much this means to the entire community, because, you know, everyone is in a very panic and a scared mode. So what my urge to the community is, don't get panicked. I mean, this is not the time to get panicked. You know, that's why, I mean, we are all rallying. I mean, see the support that you have here, right? So we are, as an IAG, we are putting you all the resources to be helpful. One is like, there is if you go onto the IAG website, you would see a COVID-19 page on our IAG website. So we are trying to bring all the reliable sources like the CDC, WHO, the SCDHEC, even the school, and plus all the other communications, because we have also teamed up with Indian Consulate in Atlanta. They're also sending us all the travel advisories and everything, but the Indian government is taking up these measures. So as we get those posting, we are also putting those things on the website. In addition to that, as Vinita was saying, we are extending our helpline now to include some of health-related questions too. I mean, of course, this is not an emergency helpline. This is just if you have any questions and all those things, you know, you can call us on 864-513-1561. I will repeat again. It's 864-513-1561. You can also call us on this line. And then, you know, as we have tagged up with several of the physicians in the community, so we will be hooking you up with one of those physicians, I mean, to get the required answer for you. So we all are here together, so we all have to get through this rough phase. So, you know, so stay safe, give the best of your time to your family, and, you know, try to be safe in this difficult time. And again, thanks, Dr. Vinita, you know, coordinating this panel, and thanks, Dr. Santosh Pijur for your time, and Dr. Ochab, you know, for your time, Dr. Nancy and Dr. Patel. Thank you.